Staring lost and vacant through the trees. And though I've tried to fight, it seems I know I feel a little rejected.
Hey guys, welcome back to my channel. I'm so excited to be on this consistency spin, obviously the last time I uploaded a video was not too long ago, so that's quite good. Thank you so much for those of you who are new here, those of you who have subscribed. So excited to have you guys in the superstar world. And if you are watching this video and you are not subscribed to my YouTube channel, you don't follow me on Instagram, make sure you hit the subscribe button here, like the video too, share it with your friends and your families, okay? And head over to Instagram and follow me at Superstar. So today I really wanted to talk a little bit about why I think it's vital and important for every single pharmacist, wherever they are in their journey, to do a clinical rotation. Now, I'm a clinical pharmacist and I've been a clinical pharmacist for about 6 years now. I started practicing in 2014 and throughout my whole career I have been essentially clinical through most of my career. I found retail a little bit boring, a little bit repetitive, and I found that I wasn't able to kind of just maximize my potential. Now that doesn't mean that retail is not for any pharmacist, or pharmacists shouldn't explore the retail route. However, I think it's so vital and so important for every single pharmacist, wherever you are in your journey, to experience what clinical pharmacy is. So by retail pharmacy, I mean you're working for, maybe if you're in Canada, you're working for Rexall or Shoppers Drug Mart, or if you're in the UK, that's basically working for Lloyd's, Boots, Co-op, I think they're called Well Pharmacy now. And if you're in the States, it's like working for CVS and the like. So basically, retail pharmacy, I think, is great, especially if you're somebody who has an entrepreneurship mindset, you're somebody who is really focused on numbers, you want to grow, and kind of like, build financially, maybe you want to be a manager of the store one day, you want to, maybe, partner with some physicians or GPs, as we call them in the UK. So that's really good. It's a really, really good route if you are that kind of person. For me, I was someone who was very, very interested in the clinical aspect. So when I'm talking about clinical, I mean things like looking at patients' blood test results, looking at, their renal function, and using that to basically calculate what dosage of medicines they should be on, being able to kind of look at therapeutic drug indexes, and using that to basically determine what doses a patient should be on. I find clinical pharmacy very interesting, because as a pharmacist I just felt like being in that position, or being clinical, enables me to really explore my career, my profession. As a pharmacist, especially working in hospital, which I worked for most of my career, I was able to kind of intervene, advise the doctors, the physicians, the consultants on the best doses and what drugs to stop, what drugs to not stop. And I think this is it makes pharmacy so much more interesting. I think a lot of people have a false perception as to what pharmacists do. So people think that a pharmacist just stands in the store and you take your prescription and refill it, or dispense, as we say in the UK, and you pick it off the shelf and you just give them the drug. But essentially there's a lot that goes into being a pharmacist. There's a lot of thinking that goes into action before a pharmacist hands a medication to you. And I found that being in clinical rotations helped me to really explore those areas a lot more. You find areas that you enjoy, areas that make you feel excited about pharmacy, excited about going to work. And if you are a junior pharmacist and you're just about to come out of university, or you are just starting off in your pharmacy career, I would 110% recommend going into clinical rotation. Now, for people in the UK, that would mean taking on a band 6 foundational pharmacist role at a hospital. Being a foundational pharmacist is not the funnest thing at all. You are going to be pushed around, you are going to be you are going to be working your butts off. You're going to be doing on calls. You're going to be doing weekends. You're going to be doing late nights. But I think all of these things really, really build your character. It builds your knowledge. It builds your patience, because as a pharmacist, you have to really endure a lot of things. I think that being in that junior position really helps you to build that and build those skills, build the skills of being able to stand up to a physician when actually, sir, this drug is not the most appropriate drug. I think at the end of the day, it is the physician's call, so if a drug is prescribed, I'm going to do a whole video about that separately, but if a drug is prescribed for a patient and you recommend something different, the physician can go against your will, of course, but being in a junior position and rotating within a hospital setting especially, I think it really helps you to build that confidence and that boldness. You're going to have times where you're on a rotation and maybe there's a consultant who just says, oh, hey, what's the dose of this and that? And you're going to be like, sorry, I'm going to need to check the dose. So those kind of situations and scenarios are going to push you into the deep end. You're literally going to be thrown into the deep end. And I think that really grows you as a pharmacist. It really prepares you to be a senior pharmacist one day. So for anybody who's leaving university, you're just about to start your pharmacy career, maybe you're thinking about going into retail. A lot of people tell me that, oh my God, I don't really like pharmacy like that. I still think it's so vital to have some form of clinical experience, even if it's for 1 year. And in the UK, I don't know what it's like in North America because I've never worked in a hospital in North America. I think that it's so important to, as I said, do a rotational position. So rotational positions essentially allow you to rotate through different clinical settings. So for me, when I was doing rotational clinical pharmacy, this was probably back in 2014 when I first qualified. So I was working on the admissions unit, I was working on the stroke unit, I worked on elderly care, I've worked in the renal unit, cardiology, I've also worked in endocrinology, I've worked on so many different diverse wards. And I think it, again, as I said, it builds up your knowledge as a pharmacist. Like you see things. I think there was a few days ago, there was a particular drug that came up, on one of our patients' profiles. And as soon as I saw the drug, it's not a drug that you see every day, but as soon as I saw the drug, I knew the indication, I knew the dose, and it just made me remember how important it is to be exposed to different clinical scenarios and different clinical environments, because then it exposes you and allows you to kind of see things that may come up later on in your journey. Now just imagine, as a pharmacist, you've done 4 years, so in the UK it's 4 years, you've done 4 years of a course at university, and all of a sudden you go into retail, and in retail all you see is amlodipine, simvastatin, you see perindopril, you see what else you see? You see your paracetamols, you see your fibogel, you see all those regular Senna, all those regular drugs. And you forget little things like carbamazepine is a therapeutic drug index drug. Like you forget that phenytoin, there's differences in terms of the different formulations have different release dates. All these kind of things you forget. And I think working in a hospital setting really helps you to remember and brush up your knowledge on those things. It enables you to have that information for when you need it in the future. I mean, how many times do you see gentamicin or vancomycin dosing in retail? So I think even if it's 1 year, I would encourage every pharmacist to get some clinical training. It helps to build your knowledge, it gives you exposure. Work at a hospital where you learn about clinical audits, understanding what a clinical audit is, what is clinical governance, getting yourself around all of these things. What is the antimicrobial monitoring system at your hospital? What are the antibiotics that are allowed in your formulary? What ones are not allowed in your formulary, so that when you get that call at 2 a.m. in the morning from that F1 who's like, oh my God, this lady's vanc level is 26, what do I do? You're not thrown off the boat. Obviously, the first few times you're going to be like, I don't know what you're talking about, Susie. But essentially, as time goes on, you're going to be building yourself, your knowledge, your experience, and everything up. I really hope that video helped you guys. If you have any questions, please feel free to email me, ore.supasta@gmail.com. Follow me on Instagram, DM me, whatever it is that you need. I am here for you guys.